Wait lang. Unstable yung net ko. Sorry. Okay. Malinaw na? Malinaw ako?
Yips.
Naka-record yun.
Yes, we're recording.
Let me... Dios marhay na banggi sa Satuya Gabos. Welcome to the 11th leg of the Partido State University Balongibog Talks COVID-19 segment. Also the second lecture for today. I am Vanessa May C. Romero, faculty of the College of Arts and Sciences, your moderator for this evening. Before anything else, on behalf of the organizing committee, we once again would like to thank you all for participating and tuning in with us in the third week of this podcast series. So do also help us in improving the quality of this activity by answering our evaluation form. We'll send in the chat box of Zoom, and also a redirecting link will open after this video meeting. The Balongibog Talks COVID-19 segment is sponsored by the Partido State University through the following academic centers. Center for Partido Studies, directed by Dr. Danilo M. Herona. Partido Institute of Economics, directed by Professor Roland John G. Bulao. Museo de Isarog, led by the curator, Mr. Earl John C. Hernandez. The College of Arts and Sciences, led by the Dean, Dr. Erlinda M. Basilia. Dr. Raul G. Bradicina of the Office of the President. Ms. Leigh Ann Odoño of the Office of the Board Secretary. The Past and Department, headed by Professor Mary Joyce B. Bulao. For a recap from our earlier lecture, Dr. Jojo Abenales earlier gave us a very interactive lecture on local histories. Today, we will be having another lecture on how to deal with the stress we are experiencing this pandemic. Our lecturer for this evening has a degree of Doctor of Philosophy, major in Human Resource and Behavioral Management. She served as an associate professor, human and counselor to Southern Philippines. He has been all different international forum and trainings, finished our university degree, given by
Nawala ata si Vanessa. Okay. Sorry for the technical problems. Third world internet. So let me take over, Miss Vanessa. Apologies. So okay, our speaker today. Okay, our speaker is Dr. Angel Malaya, mental health advocate, and she's currently doing psychological work in Dubai, so, and also a UNESCO ambassador. So let me turn over the virtual floor to Dr. Malaya.
Okay, so I'll just share my presentation. All right, so good evening, everyone. Earl, nakikita ba yung presentation? Is it visible now?
Yes po.
Okay.
Yes po, ma'am.
So we're going to talk about how are we going to overcome stress during this pandemic and ECQ. So extended siya until May 15. So I have here some techniques and of course a composition on how and why we are experiencing this kind of stress and ano ba yung factors why it's really happening this time. First, we are not really ready to have this kind of situation and we have to stay at home or work from home. Ibang-iba siya sa regular routine natin. And it's really added to our stress or worries or being anxious. Ito na yung sinasabi nilang the new normal. Okay? Pag hindi ka na stress, hindi ka naging anxious, hindi ka normal. Okay, let's talk about it. Alright, so we have here, stress comes first. So pag hindi na-overcome yung stress, if you don't have any coping skills to overcome stress, it could lead to anxiety. And again, when anxiety is not really managed, okay, magiging it could be possibility of depression and higher mental disorder. So we have to focus on the stress para hindi na siya mag-lead sa other mental issues or anxiety or panic attack. Alright? Okay, so we have here bad stress and good stress. So ano nga ba yung mga bad stress and good stress? So we have to know alin ba yung good stress that's really helpful for us to build our resiliency. If you know how to handle those good stress, it could lead to overcoming it when you have bad stress, right? So bad stress can be what? Violence, right? Bad environment, or the situation that you could not do anything. So you have to identify which is good stress and bad stress. Ano ba yung difference nila? Okay, so I have here the stress bucket. Okay, so let's identify. Academic stress is one of the reasons for students. So more assignments, disagreements with the teacher, or poor results. Here in UAE, we are experiencing distance learning, and that is part of another stress because students cannot go outside or interact with their classmates or with their teacher. Most of the time, we're doing teaching through virtual or we're monitoring students of determination or yung mga special needs students through virtual. And it's really stressful, okay, because they don't have any way of, a way of ventilation. Okay? We have also here interpersonal stress. Interpersonal stress talks about poor diet. So living on a caffeine, substance abuse, worrying about money. So ano siya? Bad stress or good stress? When you talk about poor diet, it comes with what? Bad stress. Okay, wala ka na kasing proper routine. Worrying about money, do you think it's bad stress or good stress? So pag wala kang pera and mag-worry ka pa within your boundaries, it could lead to bad stress. Right? Academic stress can be good. Okay. If you're going to manage it properly, okay? If you could cope up with the academic stress, it helps you to be more resilient to overcoming such difficulties, not just when you at school or through virtual, but when you work outside. So it becomes a good stress. Next, we have here interpersonal stress. Ano nga ba yung interpersonal stress? Maybe you feel lonely, okay? Or make friends over the internet, not in person. So interpersonal stress can be what? Either can be good stress or can be bad stress if we don't know how to manage this kind of situation. So you could use the virtual or the internet or any type of application that can help you interact with your friends while staying at home or with your colleagues like this, right? And we have here environmental stress. Just like roommates often argue with you or with your family like that, okay? Or having kind of a situation that you cannot focus on your studies. So might be it is can be leading to bad stress because it's environment. Okay, sometimes we don't have the control on this area. Okay, so in this picture we have here The coping skills, this is the ventilation where you could have the chance to weigh out those kind of stresses. Okay, coping skills. This is what you call unhelpful coping up in this area. So, anong ibig sabihin nito? If you have bad stress and good stress and you put it out on the unhelpful coping up, just like what? Substance abuse, caffeine, too much coffee, all right? You have smoking, okay? So, we have also too much gaming. So, pag masyado naman puros na lang doon na yung time mo, those are unhelpful coping ways or management that is really not very helpful. It could lead to what? Imbis na makapag-cope up dun sa stress, it can lead to anxiety or either depression or self-isolation. So, hindi siya maganda. But if you will have your bad and good stress going to this area, you have your coping skills. Ano ba yung coping skills na yun? Either if you have encounter environmental stress, you could have a ventilation of talking to your roommates. So you have the solution-focused approach. Yun ba yung pwede mong gawin to overcome that, yung solusyon? Or you will have another. For example, you feel lonely, right? So you have your coping up. Rather than feeling of being anguish, you will have your exercise. You will meditate. You will build your spiritual relationship with your God, with the faith that you have. Those are coping skills that could help you get through with this stress bucket. Okay, so I hope this presentation helps you out. And we have here, ito, let's identify ano ba yung mga toxic stress. So we have it positive, tolerance, and toxic. Let's identify the three and what's the difference between these stress toxic areas. So pag sinabi nating positive, brief increases in heart rate, mild elevation in stress hormone levels. So when you talk about positive toxic stress, comes with your heartbeat or hormonal stress or imbalances. Pinaka-prone to with women. Okay, the female one has, hormonal changes every monthly period or during pregnancy. So, mas mataas yung toxic stress na mararamdaman nila. Okay? When we talk about tolerable stress, toxic pa rin siya, but it's tolerable. It is serious temporary stress responses. So might be you will encounter that kind of feeling like a minute or a second lang, and then it will be mawawala na siya particularly, or might be you could experience it with several days. Pag 1 week, medyo na siya, alarming, or it cause also pag halimbawa medyo 1 month towards 6 months, it's really alarming. Papasok na siya dito sa toxic stress. Okay? It's a prolonged activation of stress response systems in the absence of protective relationship. Okay? Nagli-lead na siya sa toxic when it comes to we could feel anxiety, panic attack, yung when you talk about panic attack, you feel that there's a sudden changes physically. Okay, you have a fast heartbeat, papawisan ka. Okay, you feeling anxious, right? You don't have the focus. You don't have the attention anymore. That is what you call toxic stress. Okay, hindi siya ganun ka-helpful. All right. So let's have here the stress brain loop. I just want you to see kung ano ba yung picture ng brain natin once it's having or experiencing stress. Okay? So, chronic stress, inadequate sleep, so poor nutrition, emotional distress can lead to a very stressful brain loop. Okay, nag-increase na rin yung glucocorticoids, decrease of regulation ng cortisol, and of course, cellular changes in the hippocampus. And what is the effect when the brain also having this kind of stress? Okay, it affects our attention, perception, short-term memory, it affects the learning, word finding. Sometimes you will experience, ano nga ibig sabihin ng ganitong term? Or you forgot directly yung information. Okay, you have the yung kind of perception over a particular thing or situation, inability to have direct attention, inattentiveness. So those are the effect when the brain experiences chronic stress. All right. And of course, let's identify anxiety has many forms. So hindi lang siya basta, okay, I have stress. Saan ba nag-cause? Ano ba yung cause ng stress mo? So number one, it can be what? Genetic. Okay, how your parents, grandparents, and ancestors experiencing or experiences stress as well. So you have with your family, might be ganun din yung grandparents nyo having this kind of anxiety. So it could be generated with the family as well. And your brain chemistry. Okay, the type of movement of your chemical reaction in the brain. So may imbalances. Sabi ko nga kanina, it could be if the women having pregnancy or menstrual cycle or changes, that is a part of the hormonal changes. And the brain chemistry, it might be it's more on the mental inability to cope up with the stress that can lead to in a depression, okay, schizophrenia, higher mental level of illness. And of course, meron tayong life events, the situation you are faced in a particular event, just like this one, ECQ, hindi tayo prepared, hindi tayo na-orient ng ganitong sitwasyon. In even the pandemic, uh, it happened around years ago, but we don't have any idea kung paano nga ba siya when we have it at hand. So it could be cause and personality, how you look and interpret things that is happening to you. Might be ito na yung regular na attitude or personality mo towards a particular changes of your life. Okay? And let's talk about the real meaning of anxiety. So anxiety is what we feel when we are worried or tense or afraid of particular things that will happen or will happen to us. Okay. And of course, anxiety is natural human response. Lahat naman tayo hindi, walang exemption na, okay, I don't have anxiety. No, you're not normal if you will not feel this kind of situation or feel anxious. It can be experienced through, of course, your thoughts, your feelings, physical sensations, and it's particularly common to experience some anxiety while coping with your stressful events or changes. So while you are in that kind of situation, you will feel that way. You will feel kindly different physically and emotionally because you're experiencing stress or having this kind of anxiety. It might be the result of what? Fears. Okay, like trauma, dog, spider, and any type of like particular encounter. It might be due to a genetic, ayan. So genes is also one of the factors and could be linked with what? With fear or having with you sudden changes of your comfort zone and then nalipat ka sa ganitong sitwasyon na you don't have any way out, so that can be the lead to anxiety as well. So again, physical signs of anxiety. So how do we know that we are experiencing anxiety? Physically, we could experience fast, irregular heartbeat. Masyado na siyang very irregular, okay, as what we experienced before. Increased breathing rate, shallow breathing, okay, hirap paghinga, dry mouth or throat, dry siya, weak, tense, or having this kind of muscle tension, feeling lightened, or we could experiences like headache, dizziness, stomach ache, and we have also sweating, okay, frozen to the spot, and of course, sometimes affected din yung vision, okay. Practical responses to anxiety. So we have different way on how these responses could last. So meron tayong long term, medium term, short term, and of course another part of this short term. Let's have it long term. Look to address, okay, the long term underlying issues. So pag halimbawa, it could last 6 months to 1 year that you will have this kind of anxiousness or anxiety. And this should be cope up. Kumbaga, if there's a need with professional help, okay, hindi talaga kaya ng way of coping up, you should ask medical or specialist to help you out. Medium term, work with child to support them to develop strategies to overcome anxiety. Okay, so if there's an adult or practitioner that could lead also to help this. Kasi there are a lot of ways pwede ang anxiety sa bata, adolescent, adult, no one is excluded sa ganitong sitwasyon. Okay, short term, implement accommodations and modification to minimize anxiety. Yun na yung you could have exercise, balanced diet, regular sleep. Those are short term accommodation. Okay, and respond immediately when the child comes overwhelmed. So it's very important within the short term, meron ng early intervention rather than cure. Okay. Okay, so how are we going to reduce the impact of anxiety? So we have some ways here. Okay, let's move. First, it is not anxiety which is the problem, but how we deal with it that counts. That's really true. It's not the anxiety can be controlled. It's a very way for us to see problems and issues that can have kumbaga coping skills mo kung paano ka mag-cope up with it can get very helpful for you. It's unlikely to just go away. So pwede siyang pwede naman siyang hindi long term. Okay? With mindfulness, right now, I'm okay. So what is mindfulness? It is also an exercise, just a way of meditation, okay, for yourself. Hindi yung long-term na thinking na paano ko na ba solve yung problema ko. But mindfulness is having an inner peace, okay, having that emptiness of your thought that I will not think anything, I will calm myself for me to have a solution to my problem. Okay? And talk to them about their worries. It's very important na meron din tayong support group na will really be very helpful for us to recognize kung ano ba yung mga symptoms that we might be encountered, okay, or triggering us. Okay? And you have to, sometimes there are situations na we try to cover it up, we keep it to ourselves, but if there is a need to recognize your issues and ask for help or support, then you have to, okay? Because it will also help you overcome those kind of yung sinasabi natin na mental triggering ways or issues that can lead to more than what we are expecting to. Okay? And be positive role model in stressful situations. So lalo na if you're a parent, okay, you know na ganito na nasa community quarantine tayo. If the children will see na ay masyadong stress si mommy and daddy, then they're also having this kind of your modeling way could also be part of the habit ng mga anak mo. So you have to take it note that you have to be more positive sa ganitong sitwasyon. And help them to challenge negative thoughts and to understand their circle of control. Okay, paano ba pag-divert ng negative to positive? Sabi nga nila, if you don't have any control with your situation right now, then you have to control your thoughts. Okay, you have to control the way you react. If you don't have any control sa tao na yon, because that person is very negative, telling a lot of things against you, then do not control that person. You have to control the way you react and the way you will talk to that person or the way you will respond to the situation para it will not be more than yung impact ba sa'yo lesser, di ka madaling ma-stress. Okay? Alright, so I have here some, how can we support, lalo na yung mga parents or you have your brother or sister na medyo nasa very young age. So we have here some mental health well-being skills development, calming cats, so available din siya sa mga app store. The healthy coping, coloring book, journal is very helpful for them. Worry eaters, okay, para siyang puppet play. Can I tell you about depression? This is very good for teenagers. Ayan. So I hope this could be very helpful. And we have also self-help strategies. So for children, lalo na yung mga parents natin, we have here. So pag wala talagang syempre social isolation ngayon, no? Make sure that they have exercises. They have a regular exercise. And mindfulness, eating balanced diet, regular habit of breathing exercise. Okay? Importante din yung sleeping pattern. Kahit nasa bahay, you have to sleep early and wake up early. Okay. Mindfulness, of course, is very important. Okay, let's have here, how can we keep good mental health and be resilient? I have 3 tips. So first, keep laughing, because the more you smile, the more you have this kind of sense of humor, nag-change din yung, it relieve the stress hormones. So nag-change siya into the be more positive, or have this kind of positive perspective. And be optimistic. Okay, a positive, hopeful outlook will make you more resilient to overcome this kind of situation. Though we don't have any assurance kung kailan to mag-end, but being optimistic that we have a bigger God who's in control, and you still have this kind of blessing that humihinga ka pa rin, you're with your family. It's being more than positive. So remember the advice for good mental health. Ito yung paulit-ulit namin sinasabi as mental health advocate. Eat well, exercise is very helpful, sleep well, and everything is under moderation. So lahat ng kulang is hindi maganda, lahat din ng sobra is hindi maganda. So make it, everything will be in a moderate way. Alright. Okay, so I have here a diagram showing you how how human beings experience stress. So first, we have this includes thoughts about yourself. For example, I'm bad in maths. I'm not good person. My ability to cope, I can't handle at work. I can handle this kind of situation. You worry a lot about the future. If I don't get a good result, my life will be ruined. So this is a very not helpful thoughts. Okay, the event situation may, for example, this event will make me more experience a lot of anxiety or anger. So lahat yun negative thoughts. So once you have these negative thoughts, underlying na nun, susunod will be the behavior. So what I do and how I react with this kind of thoughts. Maybe you will have avoidance, nervous at habits, neglect my works, wala ka ng talagang routine, okay, you cannot cope up anymore. So it shows with your behavior. After that, it will be your feeling. So you feel stressed already, you feel anxious, nervous, sick, or you're having this panic attack, or being overwhelmed to that kind of particular problem or situation. So once you have the feeling, ayun, mararamdaman mo na siya with your physical symptoms like sleeping problems, muscle tension, panic attack, and difficulty concentrating. So saka na pupunta na, okay, the client or the patient will go to the hospital. So pag nagkaroon na ng medical check-up, wala naman the result are all negative. So that's the time that the medical doctor will suggest you have to seek psychologist, clinical psychologist, or psychiatrist to identify ano ba yung cause ng physical symptoms mo. Okay, yun pala, during the session that goes with anxiety, might be the patient is having panic attack or having this medical or mental illness already, okay? So mind medicine, I'll just share this tips that you could use. So we call it mind medicine. Very unique siya for every individual. So number 1, relaxation techniques. Mindfulness, walking, breathing, or if I have an application that I will share the next slides. Music could be very helpful as well. And for parents, you have to be very hands-on. Kayo yung mga stress boosters, or you in making and creating routines and having this kind of experience with your children. Writing with journals with them is very important. Okay? And talking and sharing. Talk to your child, talk to someone. Maybe you could record your thoughts, your audio and video, para at least pwede mong, when anxiety comes or stress comes, pwede mo siyang i-review. And this is also the time for the family to have this kind of moment, maging habit to regularly communicate. Then after the quarantine, could have this relationship na na-build in na siya. Okay, you have already communication, open communication with your children or with your parents. Positive affirmation is also very important. It reflects on your successes. Once na-affirm kasi yung mga efforts natin, either it's big or whatever it is important that it would be recognized. You celebrate it, okay? And identify 3 good things that make it be more successful para you strive harder and you do more better sa ginagawa mo. Okay? You affirm yourself. As parents, you affirm your children. Okay? As family member, you affirm your brother and your sister. So, para meron ba yung sense of positivity within your colleagues or within your environment. It helps a lot. Okay, so we have also to identify yung urgency level kasi when we experience stress, we don't know what comes first. Lalo na yung talagang you have to do things na sabay-sabay. Nakaka-stress yun. So you have to identify the urgent and important. Yun yung unahin mo. Second, not urgent. Okay, put it into the second one. The third is urgent but not important. And the fourth is neither urgent nor important. Put it to number 4. So importance level or urgency is being high to low. Ano yung dapat unahin? And then once you've accomplished things, you have to what? Give yourself a affirmation. Okay, you did it after a long period of having this kind of stressful situation in your life. Okay, we have also mindfulness. Ito yung ginagawa namin most of the time. Many ways to begin. You have, of course, to give yourself a time for you to meditate. Try some meditations yourself using apps or in YouTube. Available naman siya. And stop, drop, and breathe is one of the app that I will share later. Mindful matching, so you have to identify also yung gravity ng stress mo, identify kung saan ba nanggagaling yung stress level. Liters jar, nakakawala din siya ng stress. Okay, when you just look at it. And mindful movement, like you have physical exercise or yoga, could be very helpful. Okay? Ayan, ito yung mindfulness app. You could try to search it sa Apple Store or any app that you have. It's Breathe. So once you log in, the app will ask you, how are you? And then you could start. For example, I feel anxious. I feel having a sort of difficulty breathing. Dun yung sa mga physical. And the app will lead you to a particular exercise. You could do it in the morning and then in the evening after you go to sleep. Okay? All right, so we have here, if one of the cause of your stress is too much exposure to social media, to all of the devices that you have, then you have to avoid it or have a manageable time for you to use that one. It brings real peace if you have the control over these devices. It will not cause you stress. The more most of I have constantly how they experience this kind of stresses when they keep on comparing themselves dun sa nakikita nila sa social media. Okay, bakit kasi ganito, may ganyan, buti pa siya. When once you compare yourself, then stress comes. Every one of us are unique. We have different callings, so you don't need to compare yourself to anyone else. You're wonderfully and fearfully made, so you have to be very kind to yourself. Okay, and most importantly, you have to build your personal relationship. I believe this enhanced community quarantine in this pandemic will have a good impact to each one of us. Now, it will build the relationship with our God, Jesus Christ that died in the cross for us, for you. So you have to build it because no one knows what will happen in the future. Siya lang talaga yung nakakaalam. Okay? And I'd like to share with you, this is an online free counseling for a cause. So meron tayong mga through Facebook Messenger, Hangouts, and Skype. And you could also like our Facebook for more details. Ito yung Ugat Sandalan page. We offer a free counseling services, most especially to overseas Filipino worker. Ayan, yung mga nagtatrabaho sa Middle East and around, around the country na medyo talagang hinihirapan sila sa ganitong sitwasyon. So meron tayong mga expert. We started last April 19 and then we have it daily from 10 a.m. until 2 a.m. midnight. Okay po. And I have also want to share with you guys. I'm the BNM Neuropsychological Services. I'm one of the co-owner of this center. So if you experience mental issues like anxiety, you could also come to our center. So once natapos na ang community quarantine, you could visit us located at Unit 212, second floor sa Bicol Access Health Centrum Hospital. Okay? So we're open from 9 a.m. to 5 p.m. So alam niyo na kung saan kayo pupunta after this pandemic. Okay? So before I end, I'm sending a lot of, lots of hugs and love and strength to those people, to everyone who's staying away from home, just like me. I'm not with my family, okay, but I know I'm in a good hand. Anyone who's struggling financially, emotionally, or physically, and parents worried sick about their children and well-being, people without a stable income, our virtual hug for you guys. So I hope I help a lot and I share information this evening. Okay.
Okay, thank you so much for that very informative lecture, Dr. Malaya. So
Salamat.
at this point, we are now open for questions. Anyone from our participants in the Zoom?
Okay. Well,
Yes.
I guess they're still waiting. May I ask a question?
Sure, Earl.
Okay po. My question po is yung too much use of social media. Kasi now with classes suspended or if not suspended, turning online. So especially here in Partido or here in Bicol, na not hindi po lahat ng students has access to Zoom or to internet. So ang nagiging resort is also social media. So how do we balance using social media for schoolwork or for work and also for like leisure. So parang ganun po during this time.
Okay. Sige. You have to identify first if helpful ba yun. Halimbawa, isa siya sa mga factor na nagtitrigger ng stress mo and anxiety mo, then you have to limit at least 1 hour lang paggamit ng social media. And then you have to build a routine na when you wake up, ano ba yung pwede mong gawin? Pwedeng you clean the house, you help your parent, or at least make a habit na gagawin mo the whole day para fruitful din ba yung ECQ. Pag halimbawa talaga wala ng way, kumbaga social media lang yung source of time. Okay, parang coping mechanism mo yun. You get the point na alam mo yung boundary mo sa tinitingnan mo. Okay? Sabi ko nga kanina, you have to control your thoughts. If it's beyond your control, then that's the time na you have to decide on yourself. Helpful pa ba ito? Do you think it will be beneficial sa well-being ko? If not, then try to change your habit. Try to redirect your way. Okay? Pero pag halimbawa naman, for example, di naman siya yung triggering point or hindi naman siya naka-trigger sa'yo, then I still suggest to eliminate. You have to balance things out.
Thank you, ma'am.
Welcome.
We have another question from Lizelle Atole. Her question is, how do we deal with disturbing information coming in about COVID-19?
Okay. Sabi ko nga, you have to be in control. If, for example, news, articles, or any way of information na talagang you don't have to control, okay? Then that's the time you have to eliminate. Okay lang naman to to make yourself be informed. And make sure na it will not affect. Sometimes or most of the time, you will feel anxious. Normal yun kasi we're in this kind of situation. Pag hindi ka nakaramdam ng like kinabahan ka or feel worried, parang you're being too much on hold sa sarili mo. But if it's too much, so parang yung situation is nagti-trigger na siya to make at a point na hindi ka na nakakatulog, hindi ka na naliligo, for example, it's not beneficial. So you have to eliminate those triggers as much as possible. Okay?
Okay, thank you so much for that answer po. Another question from Karen, the Aquino Museum, Tarlac. Any suggestions for a routine for 9 and 12 years old and for parents with this age of kids? Quite difficult to balance chores and being teachers with them. Hehehe.
Okay. So, you as parent, you could set, kumbaga, yung daily routine nila could be posted at home. So, when they wake up, pagising pag umaga, ano yung first hand na gagawin? And, of course, kailangan nandun din yung study habit. Walang distance learning, pero make sure na may gagawin sila in between. Okay, like we could have like drawing, okay, so, reading stories, and in between of that, dapat may exercise. We make sure they're eating healthy food. So, wag din natin naalisin yung playtime kasi they're still kids, okay? So they have to play, and this is the time also for parents to give them such kind of routine na gagamitin nila after the ECQ. So they know how to fix their stuff, they know how to clean their room. So yung mga basic ba that they could feel that okay, I'm young but I could be responsible as early as of my age right now. So importante na nakikita nila. Mas maganda kung visual siya, okay? Like, pwede mong i-post sa ref or you could post sa room nila para they will be motivated. And what we're doing is, as parent as well, pwede ka magbigay ng key points or token for every good things that they're doing. Para pang pag-uplift lang ng affirmation. So, diba, nakapaghugas sila, they fix their bed, so you could give 3 stars or they have a reward after it. So the best reward as parent that you could give is of course your time. Even though you're working at home, make sure at the end of the day, meron silang follow-up. Meron kang follow-up sa anak mo. Okay? So ano ba yung mga natapos nilang na routine, and affirm them as much as possible. Always affirm them kasi they want this kind of affirmation. Siyempre, walang school, tapos na yung school, or walang regular na socialization outside. So it's very important that parents should always affirm them. Okay?
Okay, thank you so much. I also have a question po. This COVID-19 pandemic, work from home is the new setup for work.
Yeah.
So here in the Philippines. And lately, I see posts from the social media that people are experiencing burnout from this arrangement. So what can you advise those people who are experiencing it right now?
Oo. Kasi it's really hard.
Yes.
Because me myself, experiencing yung extended service. Okay. Kasi you're staying at home and then, for example, you have children with you. So, importante that you have to set also your routine. Okay? And make sure that you wear the best, kumbaga comfortable outfit. But, syempre, you have to take a bath, take that hygienic way. Kasi pag wala na yung regular, you're not taking care of yourself, hindi ka na mag-makeup once in a while, nag-iiba din yung point of view mo, and it comes with your perspective din, yung emotions mo, parang feeling mo, ang tamlay-tamlay mo na, so nasa bahay lang naman ako. So, it comes from the way you take care of yourself, okay? And as parent, then you have to identify yung mga, ano ba yung top priorities within the day, okay? Ano ba yung mga stressors na can lead like preparing food, for your children, for your family. So sometimes it's really stressful, and then you have to work from this time. So manage your time and redirect those stress na pwede naman siyang gawin into positive stress. Okay? So like you could do yoga with your children, with your husband, exercise. Okay, you could have a family play together. Okay, para 'di ba, it could be very interactive. Walang kalaro yung mga anak mo. So you yourself will be the one. Okay?
Okay. I have another question po po. Thank you po pala sa sa sagot.
Sure.
Um, um, when, di ba po pag halimbawa may na-aksidente, ganyan, may first aid po tayo na tinatawag. Sa mental health din po ba, meron din po ba tayong parang first aid when, for example, may close friends kayo or relatives na may suicidal tendencies, ganyan po. So, what's ganon pong case?
Okay. So, pag may ang mental first aid way that you could give is don't give any advice. Okay? Kasi advices could lead to further dysfunctional decision nung nag-open up sa'yo. Just listen. Okay? Just listen. And then, pag halimbawa, meron na siyang physical, like, hurting himself, okay? So, you have to identify ng kailan niya ba yun nagsimula? Okay, kailan nagsimula? Ongoing pa rin ba yung sinasaktan niya yung sarili niya? And ask, of course, kung may, you have thoughts ng harming yourself or killing yourself, pag may mga ganun na, and then the case will be, the person will try to disclose it to you. Pag sinabi ng client or ng friend mo, I trust you, don't open it to anyone, wag mong sasabihin sa magulang ko, wag mong i-share kahit kanino. That's the time to what? You have to disclose that kind of confidentiality. Hindi mo siya pwedeng i-keep lang sa sarili mo kasi those suicidal thoughts can lead to suicide. Okay? So you have to, halimbawa may nag-share sa'yo, you have to inform the parent, you have to inform the immediate, kumbaga sinong caregiver ng tao na yun para at least they will act on it. Okay? As parent, for example, one of the friend told you na, oh, okay, yung anak ko merong suicide thoughts or may self-harm na siya. What's the first thing to do? You have to talk to your child, okay? Secure him or her with your comfort. Kasi pag negativity pa or pag sinabi mo lang, wala lang yan, natural lang yan. So we never know, baka the next day that person will commit suicide. Then the next thing to do is to seek help. Okay, go to a specialist, go to a psychiatrist, clinical psychologist that will really help that person. Kasi sila yung mga practitioner na could give medication pag severe na yung case or could undergo psychotherapy. Those clinical psychologists could conduct that kind of interventions. Okay. So, add ko lang, it is very important na you acknowledge yourself. You acknowledge kung ano yung nararamdaman mo and ask for help. Okay, ask for help is your braver decision that you could do to yourself para matulungan mo yung sarili mo with that kind of situation. Okay?
Follow up po doon. How about po if yung person na yon, yung closest pa sa kanila, yung hindi ina-acknowledge yung na-experience nilang mental struggle. So,
Paano?
Oo po, papaano?
Okay.
So,
Okay, pag
ikaw lang yung console.
Yan, sa'yo lang siya nag-ventilate. So, for example, doesn't want to get some help and sa'yo siya nag-open up. Siguro, make it a point na you have to be more, let him or her understand kung bakit. Very important to acknowledge it first. Okay? And, secondly, ikaw mismo yung, kumbaga, mag-motivate. Okay, try to motivate that person na, okay, no one can help you but yourself. Kung kaya mong tulungan yung sarili mo, then go on. But pag halimbawa, mayroong repetition of violence sa sarili niya, like nag-self-harm, you have to be more direct sa kanya. Okay, I'll give you one last chance na gagawin mo yan sa sarili mo. The next time na sasabihin mo pa rin sa akin na I hurt myself, that's the time that we will seek support from your parents, or kung halimbawa adult naman na kayo pareho, let's go on with this kind of support outside from the specialist.
Last follow-up.
Sure.
Is it always advisable na to seek advise the person with mental struggle to seek professional help? And yung mga naka-base po dito sa Bicol, saan po kaya sila pwede mag-seek ng professional help?
Ayan. Okay. Pag nakita mo naman yung severe na signs and symptoms, pag halimbawa manageable naman, pwede pang redirect yung situation, like redirect yung habit or yung thoughts niya. Pero pag tingin mo talagang it's suicide ideation, meron na siyang repetition of suicide, like 7 attempts, 6 attempts, ganyan. You have to help that person. Talagang let's go. Dahil samahan na kita. Punta na tayo ng Naga. Okay, sa Naga City, there's a lot of clinics, psychiatrists, okay, that could help give their services. Okay. Sa amin naman, with our center, it's a neuro center. So, we could also have this initial assessment if tingin ba namin, kaya na ba to namin, or we could recommend them for psychiatrist for medication. So,
Okay po.
thank you.
Thank you so much po for the answers.
Welcome, Vanessa.
Pwede po bang magtanong?
Sure. Oh.
Kasi ma'am, recently, during before mag ECQ, ng March, before we started the ECQ on March 15, nagkaroon ng actually 2 questions. Nagkaroon ng yung mga workers from Manila, students from Manila, na umuwi sa provinces. So nagkaroon ng parang stigma na parang, kayo yung mga parang may COVID, so parang, so parang there was like a stigma na nangyari na gano'n. So how do we parang help yung mga tao na na-label tas gano'n, na baka nagkaroon sila ng emotional stress dahil na-label sila, na stereotype sila na kayo yung mga parang may COVID na ganito, ganyan. Tapos pangalawa po doon, how do we address yung psychological stress din na experience ng family members and including probably the patients na naging COVID positive. Like for example, ano yung treatment sa kanila naging iba. So how do we help, ano po yung advice na pwede nating masabi dito sa tao?
Okay. So, doon muna tayo sa yung na-label, like for example, OFW. Pag umuwi ka ng Pilipinas, talagang, ayok sa'yo, hindi ka dapat dito. Dapat kasi hindi ka na umuwi ng Pilipinas. Secondly, yung from Manila going to the provinces. So, initially, Filipinos has this kind of parang stigma. Pag na may sakit ka, lalayuan ka. Hindi lang sa Pilipinas, but of course, other countries, just like US, they don't believe na may pandemic. Okay? But initially, once we have this kind of situation, like kami, OFW, we should prepare ourselves na may ganong kind of mentality pag umuwi. Ganun din sa mga galing Manila going to provinces na you have to be mentally equipped already na magkakaroon ng ganong kumbaga stigma or connotations again, may COVID yan or possible na ganito. And secondly, aside from being mentally ready, you have to secure your physical health. Okay? Physical health, like boost your immune system, yung check your daily, ano ba, may mga changes ka ba? Okay? Psychologically, ano ba yung impact ng situation sa'yo? Kasi once you have this, you're in this kind of situation, in reality check, mag-isa talaga tayo eh. Magka-COVID ka, mag-isa ka. Nasa hospital ka, mag-isa. OFW ka, malayo ka sa pamilya mo, you're alone. So you have to be mentally healthy. Once you have that, it comes to your physical health. So, tutulungan mo rin yung immune system mo to overcome such possible diseases na might be ma-encounter mo. So, I think the next thing to do is try to manage yung situation. You know yourself na andito ka sa malayo ka and gusto mong makasama yung family mo. But you have to decide kung makakatulong ba yon or hindi. Okay? Kung it will be very helpful ba kung uuwi ka pa ba or you just stay kung nasaan ka. Para mas lalo mong matulungan yung, not just your family, but yung community nyo ba. Na you don't know eh. The problem here is you don't know kung may sakit ka. Sometimes symptomatic ka. So just to feel secure yung family mo, sarili mo, you have to decide, you have to stay kung nasaan ka. Saan ka na inabutan ng ECQ. To avoid this kind of psychological effect na syempre, once umuwi ka, ito rin yung mararamdaman mo, you feel disappointed, okay, you will feel parang may sakit ka kahit wala naman. Okay? So, another thing, yung sinabi mo, the second question, Earl, is how do we handle this kind of, kumbaga, tama ba yung situation na andito na tayo, okay? We're in this kind of, oo pa, nag-positive ka. Psychologically, mayroon talaga siyang effect. Okay, your COVID-19 holder ng ganito, meron ka na, and nasa hospital ka. Normal na you will feel anxious, normal na matatakot ka, you feel worried with your life. Those are normal things that you could feel. Okay? And another thing is you have to combat between your thoughts and your physical health. Dalawa na eh. Paglalabanan mo yan eh. Pag nag-deteriorate yung mental health mo and you think it very negatively na, okay, mamamatay na ako. That's the time that you're having that kind of thought na, suko ka na sa laban, okay? The more na lumalaban pa yung health mo, the more you have to fight mentally. Okay, yung state of the mind mo na, okay, I can overcome this kind of situation, malalagpasan ko to, and your body will also coordinate. Okay, magpa-function din siya na your immune system will also fight yung virus na meron. Okay, and lastly, na very important that I could suggest is fight. Okay, fight a good fight of prayer. Okay, dasal lang talaga. You have to pray harder. You have to believe that you have a bigger God, a greater healer, and a mighty God that will protect you along the way. Those are suggestions that I could give, and of course your family support while you're staying sa hospital. You have virtual family support, call them most of the time, every time around, so para at least meron ding you have all the means and reasons to survive. Okay.
Thank you, ma'am. May question pa po from one of our participants in the Zoom. How does one know that they or someone needs medication?
Ayan. You need medication pag meron ng voices. You hear voices. Okay na there's somebody will kill you, and then another has hallucination, delusion na may nakikita ka na but totally it's not reality. Your brain is making up stories not beyond the reality. Secondly, wala ka ng proper sleep. Hindi ka na nakakatulog for almost 3 days. So talagang deteriorated yung brain mo nun pag diretsong 3 days na walang tulog. Okay. Substance abuse, like you have anxiety, depression, but you don't cure it na kumbaga hindi ka umiinom ng medicine for that, but you're using substance abuse like alcohol, drugs. It could lead to other comorbidity. Ano yung comorbid? Sa psychology, parang if you have depression, pwede siyang magkaroon ng another mental illness, like you could lead to schizophrenia, depression and schizophrenia, or attention deficit disorder comorbid to depression. So, dalawa na yung i-cure mo, hindi lang yung depression, but meron ka pang ADHD. So, dalawa yun. So, mayroon ka pang schizophrenia and meron kang depression. So, two way of how are going to cope up with that. So, kailangan na ng medication para stabilize yung tulog niya, number one, and to calm yung patient para mapakalma. Ayan.
Yan, thank you. May I also add that ano po yan, with the prescription of a
Oo,
psychiatrist.
totoo. Hindi pwedeng mabili siya over the counter. Gusto ko ng pampatulog, hindi pwede yun. Psychiatrist, they will give that.
Okay po. May questions pa po ba? Ayan. From another question from Lizelle Atole. What if the person do not like to undergo medication? What should be done? So, may
Yes.
alternatives po
Okay,
ba?
pwede naman, may alternative way, like you could have intake of omega-3. Okay, nakakapag-balance din kasi siya. And then exercise, okay? And you could do also yung meditation, like having your mind empty. Like you have to close your eyes and then regulate lang sa mind mo na empty your mind, don't think of anything else, then mag-breathing exercise. Breathing exercise could also help yung pag may mga panic attack. Kinakabahan ka, like for example, you're taking exams or you have to talk in front of a lot of people. So breathing exercise could be very helpful. Okay. Aside from that, yung salt. Okay. Yung salt, pwede mo ilagay sa with your feet. Nakakaalis din kasi siya ng stress, or it also help you yourself calm. And warm water. You have to drink warm water early in the morning and before you go to bed. Warm water lang para mag-stabilize. And another thing, you could also have music. Alam mo yung mga instrumental music. You drink warm water and then you listen to that kind of music. Nag-stabilize din yung brain to cope up with stress na nangyari sa'yo the whole day. Okay? And I also suggest, if talagang too much bombarded, like you guys working as professor, instructor, at the end of the day, you have to give yourself, even sa relationship, like husband and wife, boyfriend and girlfriend, you have to give yourself me time. Okay? Ano yung me time? It's not about you, it's not about me, but about my inner self, my inner well-being. Na hindi lang lagi kayo nag-uusap, you give yourself time to grow ba, na hindi, kasi most of the reason why relationship didn't work, hindi nag-work out, napunta ka sa relationship, totoo, it's because of yung parang you build yourself sa connection na meron lang kayo. You want to talk about everything, but you forgot about yourself. And then dadating ka sa point na it's not about you, but it's me. O yun. Kasi wala kang me time. Okay? Self-love is very important. Okay? You cannot give it to your partner if you don't have self-love. So, and male, magkaiba sila ng brain structure. Okay, totoo yun. Kasi ang female, marami tayong neurotransmitter sa brain. So, when we decide, I want to eat that one, I want to do, lahat gusto mong gawin, di ba? In even decision making. So, pag ang male brain structure naman, iba. Gusto nila one at a time. And then, pag may problema, gusto nila direct. Okay? Ito lang yung problema, ito yung gagawin kong solusyon. Most of the time, they are listening, pero interpretation natin mga babae, they're not listening. Ayun na, they're gambling. Nag-aaway na kayo. Okay? So, let him have his me time. So, ganun din ikaw, as female brain should have your own me time para self-care, self-love can go through dun sa relationship, either husband or wife. Okay?
Thank you so much. From ano po yan, mental health to relationship
Relationship.
counselor.
Lalo na po siguro sa mga LDRs dahil sa
Oo.
ECQ.
Oo, totoo. Very helpful din. Okay.
May questions pa ba tayo from our participants? Wala na po. Okay. So, on behalf of the Ayan. On behalf of our organizing committee, thank you so much po sa pagpapa-unlock sa aming invitation in this online lecture series. And we really appreciate another counseling session from a psychiatrist to psychiatrist po. Thank you so much po. And I guess Earl John has something to say.
Okay. Thank you so much po, Dr. Angel. Salamat po ng marami. Kahit
Thank
one
you,
text away,
Earl.
1 p.m. away lang po, pinaunlakan niyo po
Oo.
kami.
Anytime that you need like this, or in the future ba. God bless your good works and good heart, everyone.
Thank you po, Dr. Angel.
Thank you.
Thank you for everyone. We'll post it later para mapanood po ng iba at ma-disseminate po natin yung information sa iba. Ma'am Basig is also watching with us. Ma'am Gigi.
Hello, Ma'am Gigi.
Okay. Sige po. Thank you so much, everyone. Thank you po,
so much
Dr.
po.
Angel.